Are you sleep deprived after a week of orientation and now boot camp? Remembering the right place to put instruments can be hard, especially when you've been sitting for a week and a half and you are more focused on the fact that your gluteus has reached maximus soreness. Do you have a hard time remembering what vital signs you were trying to assess? Do you get frustrated that you can't identify what sounds you're supposed to hear? It can be hard to remember how to use equipment, especially when you're tired and nervous. Do you worry that your patients will just run away from you? Well, worry no longer. The Clinical Learning Resource Center presents Intro to Vital Signs, a short and not boring video overview for your edification and enjoyment. You can even stand up while you watch if your sit bones are already starting to feel sore. Just be nice and stand in the back. Your glutes may be sore, but they're still not transparent.
Before beginning any assessment, you're going to want to wash your hands. Here, I have some hand sanitizer. After your hands are thoroughly cleaned with hand sanitizer, the next thing that you should sanitize is your stethoscope. Some people don't like it when you wear it like this because your hair touches it, so let's clean it. Open an alcohol prep pad. Clean all surfaces that may come in contact with your patient. Every complete and thorough assessment involves a general assessment. What is a general assessment? There's more info about this in your Bates book, as well as your PETA manual. It's really important for you to read this material before your first PETA session. This is how to take a radial pulse. First of all, take your middle and index fingers of your dominant hand and place them on the radial artery. It's next to the thumb. Next, find a clock. You need to be able to count seconds during this time. I'm going to use the clock on the wall. At this time, I need to make sure that I have a steady grasp of when I can feel her pulse. I will then start with the number 0 and I will count 0, 1, 2, 3 for every beat that I feel in my fingertips. I'll count this for 60 seconds. That will give me her pulse rate. This can be abbreviated in a 30-second duration and times by 2. After I've finished the assessment of her radial pulse, I'll continue to palpate her pulse, but now I'm going to count her respirations. I need to be sneaky though. I don't want her to know what I'm doing because it could change her pattern of breathing. So, if you don't feel comfortable looking directly at your patient's chest, what you can do is take their arm and just place it across their chest. At this time, you may be able to feel their chest rise and fall, and it also makes more sense for you to be looking during this time. You would count each respiration the patient takes in a 60-second period. That'll give you her respiratory rate. The first step in taking a blood pressure is to find the brachial pulse. This may take some practice, so practice on your friends and yourself. Once you've found the brachial pulse, get the appropriate sized blood pressure cuff. The info on blood pressure cuff sizing is in your textbook. Here you'll see artery index marker. This is where you're going to be placing the cuff on the patient, where you've palpated the artery. On some cuffs, the inside will say this side against limb. So I'm going to place that where I palpated her pulse and wrap it around. The next thing I'm going to do is estimate her systolic blood pressure. I need to make sure that the cuff is completely deflated. I'll find her radial pulse. And I'm looking at the sphygmomanometer, and I'm going to fill up the cuff with the valve closed, not open, until I completely obliterate her radial pulse. and I don't feel it anymore at about 110 millimeters of mercury. That means that I'm estimating her systolic blood pressure to be approximately 110. So I'm going to inflate the cuff to 30 millimeters of mercury higher than that whenever I do her actual blood pressure. The next thing that you need to know is what you're listening for with your stethoscope. So when you place your stethoscope over the radial artery, if I were to listen to Mary's radial artery right now, without the cuff inflated, I should hear nothing. This is called laminar blood flow. It means that the blood is flowing smoothly through the canal of the vessel. Whenever I completely inflate the blood pressure cuff to where I estimated before, I should also hear no sounds because the artery is completely occluded. Nothing is passing through the artery. I should hear nothing. As I slowly let off the pressure in the cuff, the occlusion will become smaller and eventually blood will be able to make its way through a small opening. This makes a sound. It's turbulent blood flow. Turbulent blood flow in a vessel will always make a sound. So this is called a Korotkov sound. The first time you hear a Korotkov sound, this is systolic blood pressure. So this is the pressure at which a tiny little bit of blood flow can make it through the artery again. Eventually that Korotkov sound will go away and laminar blood flow will be reinstated in the vessel. That is your diastolic pressure. There are many different ways to take your patient's temperature. One of the common ways that we take temperature is orally. This is an oral thermometer. This is a Welch Allyn. It's very quick in taking temperatures. There are a lot of reasons why you should not take an oral temperature. You can read about these in your Bates book. The first thing I'm going to do is remove the probe. I should hear a beep. And then I can apply the probe cover. I will then ask the patient, could you open your mouth? And I will place the thermometer to the side of her tongue to the back. Could you close your mouth over the probe? Thank you. In a few moments I should hear 2 beeps and her temperature should be displayed on the screen. The 5th vital sign is the pain assessment. The first thing that you want to do is define the scale for your patient. So you could say something like, Mary, I want you to tell me how much pain are you having? If 0 is no pain and 10 is the worst pain of your life, how would you rate your pain? 4. You can also do this with pediatric patients. Sometimes using a scale like this will work, but sometimes it might not. So you can define the scale by using the Wong-Baker Faces Scale and ask them to point to which face most likely represents how they feel. An additional vital sign that you may choose to assess is called SpO2, or pulse oximetry. Sometimes they're portable and sometimes they're connected to a monitor. So first of all, if it's portable, just turn it on until you see the lights on the screen. Then ask for the patient's finger. Any finger will do. And wait. She can rest this in her lap while we wait for the pulse oximeter to read her oxygen saturation and her pulse. It will give us both numbers. You'll see where it says PR, her pulse rate is 90, and her SpO2 is 97%. If the BMI is greater than 35, measure the patient's waist circumference just above the hips. Risk for diabetes, hypertension, and cardiovascular disease increases significantly if the waist circumference is 35 inches or more in women and 40 inches or more in men.
And that's Intro to Vital Signs, yours for only the cost of medical school tuition. Need more info than we can effectively cram into a 10-minute video? Of course you do! You're going to be a doctor and have people's lives in your hands. Your Bates textbook is the answer. Read it! Seriously, it's kind of really important that you read it. It's not always the most thrilling piece of literature, but it has its moments. You'll be glad you did.